So I am here with Molly, and she was asking how to approach a medical professional, like a doctor, right, Molly? Do you want to
hmm
give me a scenario?
Yeah, so it might be a little bit different. He has an independent clinic, so he doesn't go through insurance. So maybe there's like less rules for him. I'm not really sure, but um, yeah, I he basically has a clinic that's like a membership. So you pay monthly and you can see him as many times as you want. And so I know that he has, I mean, I'm sure like I think every doctor probably has people that need to get healthier. That's probably why they're going to see their doctor sometimes. And so I just thought it'd be really cool to just share with him what I'm doing and ask for referrals, but I want to do it in a way that is inviting, and I want to learn how to like what to say, especially since I'm still training and whatnot.
So what you just said, there's a lot in there that's actually relevant information. One of them is that he owns his own practice, right?
Mm-hmm.
And that he does not bill insurance. And why is that relevant? Because if he owns his own practice, he is his own boss and he is the final decision maker. And
Mm-hmm.
it's oftentimes easier for you to get in with somebody that's the final decision maker than it is to get in with a huge practice of like 50 physicians or, a
Mm-hmm.
huge hospital organization. Do they need us? Absolutely. But by the time you jump through all the hoops you have to jump through, it's almost not worth the time and energy.
Right.
And so it's always a good idea to connect with somebody that's smaller and
Mm-hmm.
somebody that's the primary decision maker. So that's a good thing. What you just talked about, that he doesn't take insurance, is a good thing and a bad thing from our perspective, okay? Because it's called oh my goodness, I'm drawing a blank on what the exact terminology. I think it's called direct patient care or concierge medicine, okay? Where people pay a monthly fee and they can get unlimited number of visits, okay? And so it's a new model of healthcare that doesn't depend on insurance companies, which is good for the medical professional in some regards. And sometimes it makes it so that they're a little scrambling for money a little bit sometimes.
Mm-hmm.
So that's good for us because they're always looking for different ways to generate revenue, right?
Mm-hmm.
Obviously, if they're a health professional, if they're a physician, a nurse practitioner, whatever it might be, more likely than not, they do care about their patients and
Yeah.
help their patients improve their outcomes. Now, one of the things in the medical world, I'm giving you a little bit of a broad answer to your specific question, just so you can
Mm-hmm.
understand what's going on, right? Is that within healthcare, where it's being reimbursed by insurance companies, especially Medicare, okay? Medicare is now kind of tying their payments to whatever outcomes the provider can provide.
Mm-hmm.
So, for example, let's say you have high blood pressure. You go into your doctor. Your doctor says, do this. You come back 3 months later, your blood pressure's not any better. Medicare says, why am I going to pay you? You didn't do your job.
Mm-hmm.
Okay. So that's incredibly frustrating for health professionals because the reason the blood pressure didn't get better was not because they didn't do their job. It's because the patient didn't take responsibility, right? They didn't follow through with whatever the health professional told them, whether it was to take medication, whether it was to lose some weight, whether it was whatever, okay? Now, 80% of healthcare dollars in America today are caused by chronic diseases.
Mm-hmm.
And of those chronic diseases, 80% of them are tied to nutrition and exercise and weight. Okay. So that means that for the person not specific to your guy, okay, but for the health professional that does accept especially Medicare, right? They are especially interested in creating positive outcomes for their patients, not only because they care about their patients, but because not only will it affect their reimbursement, but it can actually cost them a penalty. Okay. So they can get bonuses, they can get paid, or they'll have to pay to work. It's like
Right.
crazy town. Can you imagine going into work never knowing if and when you're going to get paid?
No,
So
that would be terrible.
it's a really wild world for health professionals right now, okay? And we can help them because we can help their patients improve their outcomes, which ultimately makes it so that the Medicare can pay them. In your particular situation, let's call your doctor Dr. Bob, Okay.
Okay.
Let's just call him Dr. Bob. You know, he doesn't have to deal with Medicare and he doesn't have to deal with insurance requirements. He's, you know, that person's going to pay their flat rate $150 every month, whatever it is, what. But like I mentioned, what we're looking at is what's in it for them, right? What's in it? What do you think he might be looking for? What he might be looking for is ways to generate revenue for his practice and ways to help his patients get better, because the way that he's set up, he gets paid a flat rate. And if that patient comes in once a month or 10 times a month, they're only paying that flat rate.
Right.
So it's in his best interest to help his patient as much as possible so they're not coming in 10 times a month, right?
Right.
So that's how we can help them. And so one thing I do want to mention in terms of Optavia and approaching medical professionals is that they usually will require, Optavia requires that if we're going to cold call medical professionals, that we be at least an executive director and certified. Okay. That's for cold calling someone that you don't know. And the reason for that is because they want to preserve Optavia's reputation, right? And the doctors, they tend to eat people alive because they know all the science and they know nothing about health. They know nothing about Optavia, but they think they know everything about everything, right? And so we want to make sure that you're able to kind of speak with them and not in this number, right?
Yeah.
Optavia's reputation. When you have a friend like you have in your situation, and someone you know on a more personal level, then by all means, you're welcome to connect with them.
Okay.
So there are a couple of questions that I ask when I connect with a health professional, because I want to help them. I want to understand their need, and I want to help them understand that they have a need. Make sense?
Yeah.
Okay? So I will always ask, hey, so what percentage of your day is spent on obesity-related issues? Things like back pain, high blood pressure, high blood sugar, cholesterol, things like that. Depending on their specialty, especially if they're primary care, I've heard that it's usually at least 80% of their day is spent on. And then I ask, what percentage of your patient population is overweight or obese? And we know that the national average is, I want to say something like 68% of Americans are either overweight or obese. So if your doc tells you any number that's way different from 68%, we have to explore what planet they're practicing on. And sometimes they don't know what their percentage is, and so I volunteer. I say, so the national average is about 68%. Does that sound about right? Okay. And so right there, what we're doing is we're allowing them to see that there is a problem, right?
Yeah.
And then I ask them, so what do you do for your overweight clients? What solution are you offering? And then I ask, how's that working?
Okay.
And so usually that alone is enough to kind of highlight the fact that they are drowning, because most of them don't have the time, energy, interest, motivation, okay, to tackle weight. This is what happens, okay? Let me tell you what happens. I'm going to put on my nurse practitioner hat, okay? And if somebody comes in to see me and they're coming in for an ingrown toenail, okay? Completely irrelevant to lifestyle necessarily. But if their blood pressure is 200 over 100, which is very high, I don't care that they're here for an ingrown toenail. I'm going to address that blood pressure. They're not going to leave the office with a blood pressure of 200 over 100, okay? But this is what happens. People will come in for an ingrown toenail and have a BMI. Normal BMI is between 18 and 25, right? Someone can come in from an ingrown toenail and have a BMI of 40. That BMI is never addressed because it's not relevant to the ingrown toenail.
Gotcha.
It's not perceived as a life-threatening illness, but it is, and it should be addressed, right? So this is what ends up happening is that the health professional, when they're seeing their patients, they're focusing in on why are they here right now? I remember people would come in with like maybe 5 complaints. I have this. And the insurance company, and I don't know how it is with your friend, just because I'm not as familiar with that reimbursement, but insurance companies will only pay for so much. And so I actually had to tell my patients that sometimes. I'm like, today we can deal with 3 of your issues. What are your top 3 priorities? Okay. And so that's where the professionals are thinking. They're thinking, okay, why are they here? They're not thinking, how can I help this person no matter why they're here, right? And so when they come in for their blood pressure, they're thinking, okay, let me help them fix their blood pressure. I'm not thinking about the fact that if they lost 15 pounds, if 50 pounds, 100 pounds, that would fix their blood pressure. You see what I'm saying? They're focused on what they're there for, because that's what the insurance company is going to pay for. And they have to think about their bottom line, which is something that's incredibly frustrating for most health professionals. Okay. So I'm giving you a little bit of a background of how the health professional thinks, because even your doc, okay, people are going to come into him because they have high blood pressure, right? So is he automatically going to think, oh, if they lost weight, their blood pressure would come down? Sometimes they'll mention it, sometimes they won't. So that's part of what we want to understand. What are you doing for the people that are overweight? What solution are you offering them? And how is that working? And so once we affirm that whatever it is that they're doing is not working, then we can say, I actually just launched my own health coaching business. I use a physician-led program to help people retrain their habits. So I use a lifestyle program to help people embrace new habits and, more often than not, control their weight, which reflects in their blood pressure and their blood sugar and their cholesterol, and all of that. And so I give them a very, very superficial introduction, right? I'm a health coach, use a lifestyle program. I help people retrain their habits. I help people lose weight. On average, our patients lose about 8 to 10 pounds a month.
Okay.
So just for your information, when someone loses only 10% of their body weight, it reduces their risk for chronic disease like high blood pressure, high blood sugar. It reduces those risks by 50%. So imagine just 10% drop in weight improves their health odds by 50%, right? And I think that most health professionals know that. I'm not sure that all do. And so I oftentimes will posture it that way. Like I say, well, as a 10% loss in weight translates into a 50% reduction in, lifestyle related diseases. I wondered if you would be willing, first of all, if you'd be open to learning a little bit more about what I do, and if you would be willing to refer maybe 5 clients to me so that we can do a little bit of a pilot study and see how it works for your patients.
Okay, that's really good.
So once you've kind of done that initial introduction, if they say they're open to chatting, then I would schedule a 3-way call, either with myself or Dr. Joe. We'll explore which is the best option for that one individual, okay? Where we can kind of explain a little bit further. I found that with health professionals, they're probably not going to watch a video, a webinar, but we can always ask, would you be willing to watch that features our medical director? And if they say yes, then by all means, send them a webinar with Dr. A. But more often than not, I found that just isn't going to happen. So I schedule a time. We can schedule a time to do a Zoom or over the phone. Any questions?
No, I don't think so. Would it be best if I called him and asked to meet with him and sit down and have this conversation, or over the phone, for just introducing it, or what is generally the best?
What kind of relationship do you have with him right now?
He's been some of my parents' best friend, my whole life. So I've known him my whole life. And then also we see him for whenever we're sick, or I don't know. I haven't seen him in quite a while, but yeah, I have a pretty good relationship with him as far as just family friend and stuff. So
if you have that level of a relationship with him, I might even call him outside of work, right?
Okay. Yeah.
Hey, I don't know if you know this or not, but I just launched my own health coaching business, and I wondered if we could schedule a time to talk a little bit about how I could maybe help your patients, if it's something you're open to exploring.
Okay.
sometimes for health coaches that might be watching this, right, they might not have that same level of intimacy, but it's still their primary care doctor that they've been going to for the past 15 years.
Yeah.
And they're going to see that they lost weight. So when you go in to see your provider and you're getting evaluated for whatever reason, it's a great time to just say, by the way, they're going to notice that you lost weight, right? So by the way, I actually became a health coach and I would love to help your patients. Could we schedule a time so that we can explore how I can do that? So that would be how I would approach it in that situation.
Okay. That
Any
sounds
other question?
I don't think so. And if they are interested, then that's when I would schedule a 3-way call, either with you or Dr. Joe or something.
Yeah.
Okay.
So I'm going to stop recording.